Hey there everyone! I am JERICO Nagal from Columban College of Barreto Campus. Today, I will be performing a return demonstration on log rolling of the patient. Without further ado, let's get started.
In hospitals, log rolling techniques are crucial for safely repositioning patients who are immobilized or have limited mobility due to medical conditions or procedures. These techniques help to prevent pressure ulcers, maintain proper alignment of the spine, and minimize discomfort for patients during activities like turning or transferring them between surfaces. Additionally, log rolling is essential for safely and efficiently moving patients during medical procedures or when providing care, contributing to the overall comfort and well-being of patients while reducing the risk of injuries for both patients and healthcare providers.
Good morning, ma'am. I am JERICO, your student nurse for today. And today, I'll be performing the log rolling procedure or the lateral position. May I ask your consent lang po and your cooperation?
Yes.
Okay, first is, may I know your name and age po?
I'm Persitas Chitrao. I'm 60 years old.
Okay. How are you feeling today, ma'am?
Okay.
Okay, that's good to know po. Okay, before I start the procedure, I will now provide a privacy for the client. I will closing all the windows for the privacy of the client. Next is, I'll be performing a proper hand hygiene to avoid the spread of microorganism. Also, I will be putting my gloves on. Now that I have worn my gloves, I will be now assessing the ability of the patient to perform the procedure.
Assessing the patient before performing the log roll techniques is essential for ensuring patient safety, identifying any potential risks or complications, and providing patient-centered care in the hospital setting.
Now, I'm gonna ask you some few questions lang po, ma'am. Regards on your medical status. First po is, did you undergo any surgery po?
No.
What about any previous injury?
No.
Okay. Now the patient has confirmed that she hasn't done or experienced any of those given situation. I will now proceed to the process. Okay. First is, I will make the level of the bed on my waist level para to avoid the back pain during the process. And now, I'll be removing the blanket of the patient. Next is, I'll be putting the patient on this side para kapag nilag roll po natin yung pasyente is hindi siya mahulog o hindi masobrahan sa kabilang side yung pag-ikot. Okay, I will moving the patient on 3 segment po. First is the upper, the middle, and the third and the lower. Okay, at a count of 3 po, I will move you po. Okay? 1, 2, 3. 1, 2, 3. 1, 2. Okay, now that the patient is on this side, I will place a pillow between her legs.
Putting a pillow between the legs of a patient during the log rolling techniques helps to maintain proper alignment, prevent friction and pressure on sensitive area.
Also, I will adjust the pillow of the patient. Okay, now I'll be calling my corners to help me to do the log roll technique. I will now calling my corners, Miss Nurse Acuña, to help me to do the log rolling technique. But first is, I will put the arms of the patient on her abdomen. The other arm is on relaxed position. Okay, Miss Acuña, can you please hold the patient on her abdomen? I will place my hands on the shoulders of the patient and on her lower extremities. At the count of 3, I will roll the patient po. 1, 2, 3. Okay, now that the patient is on the lateral position, I will also adjust the pillows. Also, I will put a pillow on her back to support her back and to avoid the back pain or any certain condition. I will also put a pillow on her arms for the support. Now that the patient is on a lateral position, I will now put a blanket on the patient. Okay. Next thing for me to do is, I will ask the patient if she feels comfortable on her bed. Ma'am, do you feel comfortable po?
Yes.
May nararamdaman po ba kayong pain sa inyong body?
Wala naman.
Okay, now I will put the level of the bed on its normal level and make sure that the wheels of the bed is locked. Next thing is I'll be documenting the process. Okay? As I observed, the patient has the ability to perform the procedure. Also, the patient doesn't feel any pain and she is comfortable on her bed po. Also, the patient doesn't have any immobility on her joints or any part on her body po. Okay? Ma'am, do you feel comfortable naman po?
Yes po.
Okay, now that I'm done with the procedure, I will now remove my gloves and do the proper hand hygiene.